So this is the first of like our video series that we're going to go through some of all the really good content that we have online, but we're going to kind of talk through it so that you can listen to it while you're exercising or whatever you need to do. So our first topic we're going to go through is just what to expect if you come to a cranial consult because you're worried about your baby's head shape. So we're going to go through 3 signs of what to look out for, but also what to expect throughout that appointment and just literally walk you through the consult. And I think, I don't know about you, but families are so often they get done, oh my gosh, that was so helpful. Recommended a helmet or not. I feel like just the information is really helpful.
They're super grateful just to have the data in front of them and to make an informed decision on if they want to move forward or not.
Yes. So let's go first. How should a family? So I'm going to interview Callie. She is taking on all of our cranial consults as I've taken on more of the lower extremity and scoliosis stuff. So she's the funnel for all of that. So how and when should people schedule an appointment?
Our big perspective is families, if they have concerns about head shape, they should schedule an appointment.
What should they do? Should they call our office?
Easiest way to do it is honestly to schedule online. We are busy in the clinic. We don't answer the phone a ton. We will get back to phone calls, but the easiest way, we have made our scheduling online platform so easy. That is by far the easiest way to schedule with us.
So it is just Callie and I here. So when we're with patients or if we're with patients, we can, so it's always a callback. So you can just go right to our website. Not only are you going to get a bunch of good information there, but also it's going to guide you through the scheduling, which then sends your intake information. So you can be completely ready. So when you come in, the appointment's very simple. So come in as soon as we notice something. So 2 months, 4 months, 8 months.
I mean, some families notice it right from birth. They'll maybe at the 2-month doctor's appointment, they'll bring it up. And at that point we get either wait until 4 months or see, some families are like, no, I want to come in right away. And so we are happy to see families as early as they would like to for their appointment. Yeah. We have clear guidelines on when we could fit the helmet, but we're going to offer as much information as we can.
The one thing that maybe would be different than what it says on our website is babies who can't hold their heads up, it's really hard for us to scan them.
Right.
So sometimes we'll just do pictures and a visual assessment. So that's something that might be a little bit different than if you walk through the flow online.
And it's also, you don't have to have your pediatrician necessarily on board right away. A family can come in, it's a free consultation, you don't need a referral just for that. Yeah. It does not mean we're gonna push the helmet on you. We just want families to have an informed decision. So you do not need to wait until your 4-month appointment or your 6-month appointment to ask if you can come to our consultation.
And we get a lot of that, especially we get a lot of word of mouth stuff. So as families, we're in year 5, so as families have been through here, we'll get a lot of, my friend told me their kid had a helmet and we should really come in early. So just like as a statistic, about 60% of the babies actually get a helmet. So there's 40% of babies who are either, we don't recommend a helmet, if they're young and we're able to reposition them where it actually improves. And then some of those are if we're not network or insurance issues, but not everybody that comes in the door leaves with a helmet. And I think that's a big myth. Yep. Let's stay on topic. So you come in, you scheduled online, you took care of all your intake, you come in, we have our handout that we go through. So you come in, we're in our waiting room, so this is where you're gonna sit. And then what do we do next?
So in the intake, we ask a few questions about birth history, developmental history, medical history, and that gives us a really nice picture of what may have led to the flatness to begin with, how concerned is the family about it, are they doing any therapy for neck tightness or anything that would help resolve it potentially, or that they've tried to work with repositioning to help the flatness from getting worse. That's really important from an insurance perspective, that we need to know that information. So we'll talk through the birth history and all of that developmentally, all of those things, and then we go into measurements. So we get a lot of objective data at this appointment. That is really what is very important, is the objective data, and then our just recommendation. Again, we don't push helmets on everyone, so we are just letting families make that decision on their own. But the measurements come from a series of tools that we use to measure circumference and head shape and things, and then we go on to a 3D scan. The scan gives us hard numbers to work with, tells us what shape the baby has, how severe is it, are they even a candidate for a helmet, and then from that we can extrapolate what we would predict how long they would potentially need the helmet and treatment. From there, we can make recommendations on which helmet style we would suggest. So we get a lot of information from our objective data, and then we can share that with the family based on our recommendation of if they would benefit from the helmet or not.
And I always say the measurement's only one piece of the puzzle because there is a visual presentation, but we need those numbers because families don't want to be like, I don't know, it's not that bad.
Right.
You came to us for a professional opinion. We're going to give you those objective measurements. That is one piece of the puzzle, and it's a huge piece. Like that, off the numbers, I'd say 80% you go off the hard numbers. And then there's a few where it's like, visually it looks worse even though the numbers are low. And something that was really important to me early on was making sure that we're not just giving you the numbers, but Callie was just saying you actually understand what those numbers mean. So we're not going to get into that today. At some point maybe we can, but so taking objective measurements, taking an objective scan, and then making a recommendation from there is what we're going to do here. The other thing, which I sometimes just take for granted, but we're also going to take a look at insurance.
Yep.
So Callie, talk through what's like, okay, cool, you recommended a helmet, now what?
Yeah, so we really appreciate when families fill out their insurance details on their intake paperwork, because we have a gal who we work with who looks at all the benefits ahead. We have a very unique ability to say, if we have all that information, you come into the appointment, we say, we're in network, nope, we don't need prior authorization, yep, this is how much our best guess of what you would potentially, and we could order the helmet. We really have a streamlined process.
You're telling me I'm not going to...
No, you will not be getting the helmet today. Yeah, so it's unfortunately, we can't move that quickly with it.
They're custom to every baby's head shape specifically, so.
Yep, so insurance, the side of it is if we know ahead of time what we're working with, that can streamline our process and get the helmet on the head quicker. There certainly are specifics with every plan. Our Medicaid state plan has different requirements and things, so we have to talk through some of that at that appointment as well. But if the family can leave with a solid understanding of the recommendation, potentially what they would owe for insurance, and then what the next steps are if they want to move forward, that's really the goal.
Yeah, and if we can order the helmet, that's going to be fit 2 weeks later. So it takes 10 to 14 days to actually fabricate the helmet. So we would be fitting that in 2-ish weeks. And okay, you want to have it streamlined, you want to have this all taken care of. Why is that so important?
Age and timing really matters when we're talking head shape, and we try not to use this as a way to pressure into, but if we can fit a helmet between 4 and 6 months of age, that is the sweet spot. Babies' heads are growing so quickly during that time that if we can capture all of that growth with a helmet, the treatment time is quite a bit shorter, and the helmets just seem to remold the head better in that time. There's a big growth spurt around 6 months, and so we want to capture that growth spurt because capturing it just means we're going to accelerate the process faster. If a baby is...
So, to interject, why this is so important is the helmet is not pushing to reshape the head. It is creating a hold and a void space. So when we're saying growth is so important, helmets work off of growth, not pushing the head.
Right.
So we need growth for a helmet to work. 2 things have to happen for a helmet to work. The head has to grow and you have to wear the helmet.
Yep. And on that point, I'll stress the importance of compliance being 22 to 23 hours a day of wear, because if we're getting outside of that, especially if they're younger and growing faster, we're risking outgrowing it, the helmet not fitting well, redness being there, and you're just not going to get as good of results, as quick of results, because you're missing out on growth that could potentially go into the flat spot.
Huge.
Yep.
Okay, so we'll go through some frequently asked questions. And this is on also so this is something that you would go through. Okay, so I feel like I pretty much have this one. You probably do too. What are cranial remolding orthoses? Crows, or called, those are all the things we hear them called.
So that's essentially what a helmet or cranial remolding orthosis is: a specialized custom device for a baby to wear that is meant to remold their head
for moderate
to severe deformities.
This question isn't on there, but I think I usually throw it in here around here. So for moderate or severe, what about mild? What's the expectation if they have a mild flatness or deformity?
We get that question a lot because the question ends up being, is it going to improve on its own?
Yes.
And when our best estimate is that a flat spot will improve about 1 severity level with just natural time and growth. And so if they're starting at a mild range, likely by the time they're a teen and adult, that would be within our optimal ranges. We can't say that 100%. That's the tricky point. And some families at a mild range, it bothers them enough, they want to correct the flat spot at that point.
Why does my baby need a crow?
More than likely, it is because of a muscle imbalance, or we notice mostly in the neck, there's a high correlation of torticollis with specifically one-sided flatness, the plagiocephaly.
Yeah.
If a baby has straight flatness across the brachycephaly, in my experience, that just seems more of a positioning in utero, and then when they were born, and some babies just prefer to sleep flat on the back of their head. So really it comes down to utero positioning, and if there's any underlying neck tightness that would be contributing to one-sided flatness. And we really don't want to shame families into saying, oh, they spend too much time on the back of their head. Once a flat spot develops, it is really, really hard to get them off of it. And we don't think that it is some neglect or something.
And I would say, like, babies who have bigger head circumferences to begin with, and really good sleepers. Like, we'll have a lot of parents who are like, well, they slept through the night since they were 6. Babies who sleep on their backs and sleep flat because that's kind of their preference. There's not much you can do to offload that. So that's where we like to always really put in this isn't your fault. There's a lot of things that contribute, and we have families who it's their second baby. First baby had a helmet. We did everything and they still get it because that's just their preference. Or they had that torticollis or what.
And we do see, we have several sets of twins in a clinic because of just cramped room in there, and they're often premature. Preemies are at a higher risk as well, so there's a few risk factors.
And then, I don't usually get into this too far, but also babies who have developmental delays, even if they're not recognized, often the flatness comes from that delayed gross motor, and kind of come to light later on, but that's likely, it's not that the flat spot caused the developmental delay, it's more that the developmental delay caused delayed gross motor milestones, which then caused the flatness just from the being flat on their back. Okay, what if I don't proceed with helmet treatment? What could happen?
That is a big question. That's probably the
highly debated
questions we ask. The way that I approach it, unless we're talking like very, very severe cases, specifically divided the plagiocephaly, I try my best to reassure families that there is not going to be any developmental disability, there's not going to be any impact on brain, they're going to be the exact same kid regardless of if they correct the flat spot or not. We do see some evidence in the literature about shifting of the ear and jaw. There could be higher cases of TMJ or twisting of the jaw on the side of the flatness. But other than that, it's
so debated. That's one where we are careful with that because we have some of our referral sources who would say, no, that has no correlation, but there are studies out there. So there has been some correlation, not necessarily causation, but it's something to just be aware of, I think.
Functional concerns are things like glasses, hat, helmets,
sunglasses,
and headbands. With some girls, they just literally fly off of them because it's flat.
We had a dad who had really bad brachycephaly, and he younger than me, so he had slept on his back, and he was like, oh, I could never find hockey helmets that fit. I could never. Sunglasses are trouble because his face is very wide, and some of that is genetics. Some people do have just a wider face box or different shaped heads, but those minimal and not at the same time, so it's again something to be aware of. How long will my baby need to wear a helmet?
That is dependent on a couple different factors. Most importantly, well, I don't know if most importantly, the age when you start the helmet for sure, but also how severe is it, and what type. There's some that take a bit longer than others to correct. So if a baby is older, like I was saying before, the helmet's it's gonna be a longer treatment. If they have just one flatness of the plagiocephaly on one side, often that rounds out much quicker than if they're flat straight across the back and they have one-sided flatness. So it's dependent on the shape. I think our average treatment is between 2.5 and 3.5 months, I would say. I think it's trending downward. It's getting closer to maybe around the 8 to 10 week mark.
And some of that might be influenced that we do not say you need to stay in the helmet until your baby reaches 5 millimeters, which is our goal. We don't say that. We say we want to get them into like at least improve one category or into the mild category. And then from there, it's ultimately up to the families. We can wear the helmet as long as you want, but so often we have families that are like, oh my gosh, it looks so much better. We've seen so much improvement. We're ready to be done. And depending on some factors, sometimes we'll coach them to say, we can be done. Did you consider this and this? And other times, all right, it's up to you. How much do helmets cost? So I'll answer this one. Just helmet cost is dependent on insurance, so there's different contracts. And then private pay cost is variant depending on, well, it's not variant, but different discounts for if you need a payment plan or if you're paying upfront. You're like, we have a twin discount or things like that, but we go through all of the financial stuff up front. We try to be as transparent as possible. That doesn't mean that we don't get quoted wrong from insurance. We just had an error where a checkbox got checked and so our quote was incorrect. But we try to be as transparent as possible and then try to take care of that. But we're not perfect. So I feel like that was tons of information and we went through what that timeline looks like as well. Any other things that you think families that could be really helpful to families, just like if they want to know what's going to happen when we go in, because hopefully that's what this video will give them.
I think it's just re-echoing what you said before. I just had one just this afternoon. I'm so glad I came to this. And it's just feeling like peace of mind that I'm not crazy for seeing it, or other people, oh no, it doesn't look so bad, but it bothers some parents.
Yes.
It really does bother them. So she was very grateful to be like, oh no, he does have a moderate to severe flat spot, and they can decide how to use that. Yeah.
And we always have a free consult that includes all this, and then we do have families, can we wait a month and come back? So we can do that. Depending on insurance, there's charges for some of those appointments, but it's up to you when we move forward. Until we click order on the helmet, you're not committed to it.
Right.
All right, so hopefully this is the start of a great thing, and we can give you lots of great information.
Yeah.
I don't know. So.